Hi everyone, welcome to Raw Online. I am Dr. Chitrakala Sugumar, DGO and MD Pathology. I am a pathologist with an experience of 16 years in the teaching specialty of pathology, and I am very glad to meet you all through this Raw Online platform. We shall see about the pathological aspects of respiratory system. Today we will see about pneumonias and lung abscess. We shall start with the history. A 56-year-old male with complaints of fever, cough with expectoration, difficulty in breathing and fatigue for 4 days duration presents to you in the OP. What will be your clinical diagnosis? So, with a history of fever, cough with productive sputum, difficulty in breathing and fatigue. So, fever. The likely diagnosis is to be pneumonia. So, we shall see how to define pneumonia. Pneumonia is the inflammation and consolidation of the lung parenchyma. What is consolidation? It is filling of air spaces of the lung with exudate. How shall we classify the pneumonias? Based on the etiology, it can be infective and non-infective. Infective causes, it can be either due to bacterial, viral, fungal, parasitic or more common in our part of the world, tuberculosis. Non-infective causes include toxins, chemicals, aspiration pneumonitis. Based on the morphology and which portion of the lung it involves, it can be lobar pneumonia, bronchopneumonia and interstitial pneumonia. Based on the duration of symptoms, pneumonias can be either acute or chronic. Clinical manifestation and types of pneumonia goes as primary or secondary pneumonia, typical or atypical pneumonia, community acquired or hospital or ventilator acquired pneumonias. So, this slide shows how the pneumonias can be classified. It can be either bacterial or viral or atypical or fungal. Bacterial includes community acquired bacterial pneumonia and hospital acquired bacterial pneumonia, which is otherwise known as nosocomial pneumonia. And viral pneumonias can be flu related, common respiratory viral pneumonias and the pandemic which we are experiencing now, the SARS type of viruses. Fungal pneumonias can be either due to opportunistic or exposure related from the soil, etc. So, what are the factors predisposing to the bacterial pneumonias? Loss of cough reflex as the patient may be in deep anesthesia or the comatose patients, injury to the mucociliary apparatus, interference with the phagocytic or the bactericidal action of the alveolar macrophages, pulmonary edema, congestion and accumulated secretions in diseases like congenital cystic fibrosis or bronchial obstruction either due to foreign body or phlegm or any tumor. So, we shall see what are the pneumonia syndromes. The pneumonia syndromes may be community acquired acute pneumonia or community acquired atypical pneumonia. Community acquired acute pneumonia, the most common cause is the Streptococcus pneumoniae, which constitutes 80% of the etiology of community acquired acute pneumonias. It is colloquially known as pneumococcus. Next comes the Haemophilus influenzae, Legionella pneumophila and Klebsiella. Community acquired atypical pneumonia, we have the Mycoplasma pneumoniae and the Chlamydia species. Viral pneumonias, it includes the respiratory syncytial virus and the children, they encounter the para-influenza as the common etiological cause and influenza A and B in adults and SARS virus including the SARS-CoV-2 2019. So, based on the specific mode of infection, there are certain organisms which predilect to cause infection in certain conditions. Nosocomial pneumonia is the hospital acquired pneumonia in which the gram-negative rods, the Klebsiella and Pseudomonas play a main important cause and Staph aureus, especially the penicillin resistant type. Aspiration pneumonia, we have the anaerobic oral flora like the bacteroids and the fusobacterium, aerobic bacteria like again the Streptococcus pneumoniae, Pseudomonas and the H. influenzae. Based on the chronicity, it can be chronic pneumonia like nocardia and actinomyces, granulomatous etiology like Mycobacterium tuberculosis, atypical mycobacteria, and the Histoplasma capsulatum, the fungal infection. Necrotizing pneumonia and lung abscess, the common etiology is the anaerobic bacteria and or mixed aerobic and anaerobic bacteria. Next comes the usual cause, the Staph aureus, Klebsiella, and the type 3 pneumococcus. What is the important etiological factor in pneumonia in immunocompromised host? It can be due to viral infection, the most common being cytomegalovirus, the Pneumocystis carinii, Mycobacterium avium intracellular, aspergillosis, and the candidiasis, of which Pneumocystis carinii is the most important cause of pneumonia in immunocompromised host. So, we have seen pneumonias is nothing but the inflammation of the lung parenchyma, which later leads to consolidation. It can be due to bacterial, of which the most important cause is Streptococcus pneumoniae, viral, the most important cause is adeno, fungal, granulomatous infection due to Histoplasma, and parasitic causes.